So many times when a patient comes to me worried about the size of the clitoris, that it's too large, have already had the wrong surgery done. In fact, I spoke with a patient recently from out of the country who's had no less than 3 different labiaplasties done with 3 different doctors. And it didn't help, it actually just made things worse, because what the patient truly needed was a clitoral reduction. This patient, for example, had way in the past taken anabolic steroids. She had a lot of growth down there, which didn't really get better after she stopped the steroids. She had very little body fat to begin with and was concerned that when she looked down, she saw a penis. So she went to the first doctor, they just did a labiaplasty. The second doctor, I believe, they did a clitoral hood reduction, as well as another labiaplasty, and then the third, I think, another clitoral hood reduction, which just serves to make the clitoris more prominent and more obvious, and there's less hooding involved, and so she's very unhappy with this. And in fact, just out of curiosity, I googled clitoral reduction, and immediately it switches. There's only 1 or 2 results for actual clitoroplasty or clitoral reduction, and it switches over to clitoral hood reduction. So it's very important for patients to know and understand what the difference is. When a doctor is doing a labiaplasty, typically we're talking about the labia minora. There's other procedures for the labia majora, but we're just dealing with the skin around the clitoris. Oftentimes they'll offer what's called a clitoral hood reduction, and here in blue is typically what they're removing, is just some of the skin over the clitoris itself. And in certain cases, this can just make the problem more obvious because you have less hooding of the clitoris. And if, for example, a patient has a very sensitive clitoris or they feel it's very exposed, this can actually make the situation worse. Typically, when we're doing a true clitoris reduction, we do a clitoral hood reduction as part of that, because we're decreasing the length of the clitoris, usually the glands as well, and we're tucking everything back up closer to what we call the anterior fourchette, where it belongs, typically with normal anatomy, depending on the patient's preferences. But I think a lot of education is needed around this so patients can avoid unnecessary labiaplasties and get the surgery that they really need.